Good morning, happy day. I had to hop on here really quick, inspired to after talking to a couple different patients. One of my great honors in the practice is tracking people through progress and getting to have progress reports with them. So seeing where their child started or themselves and where they are today and then where they're going in the trajectory of optimal health. And often what we start talking about is the gut. And I am so happy that there's so many people that are starting to focus on nutrition and what they're feeding themselves, because literally what you feed yourself is feeding your brain and it's feeding every single cell in your body. So it really, really matters. And it matters even more so to your brain because there are 9 times more fibers heading between your stomach and your brain than anywhere else in the body. It's highly, highly important. In your gut houses 70% of your immune system. Pretty important because it's a pretty big portal of entry of any sort of virus or bacteria that can get in through your eyes, nose, throat. There's mucosa filling your gut that can literally help send off an alarm system saying, hey, here's an intruder, let's get him out. There's also a ton of serotonin, which is a sleep chemical that is in your gut. So it really, really matters how well your gut is doing. We know a lot of people come in for digestive complaints, and when we can trace it all the way back to the brain and the gut connection, here's how. There is a beautiful nerve, and it's called your vagus nerve. It's one of 12. There's 12 cranial nerves. It's one of 2 that actually exits the cranial vault, and it exits right here next to your first cervical vertebra. There's a little exit for it right near the artery and the vein as well that's coming out, and we've known for a long time that there can be some restriction, and we call it low vagal tone. And that gut-brain connection starts to get dampened. So we start to heal our gut up, but the connection isn't there to the brain, because the vagus nerve has been shut off, choked off, or not working well at all. And here's the great thing, modern science has started to figure this out as well, which is awesome because then we get to use their research. We look and say kids with sensory issues, focus issues, and attention issues have low tone in their vagal nerve. Well, what do chiropractors do about it? We do very specific neurological-based adjustments to help free up that vagus nerve on infants, on children, on adults, of course, because it's also running a lot of other autonomic functions, not only the gut, but it's running the heart, it's running your kidneys, your liver, everything that needs to be healed and repaired for the day. That vagus nerve wanders, that's what vagus means, is wandering through all of your organs and glands and innervates them for the parasympathetic, so the opposite of the fight or flight, the sympathetic response. It's what's turned on at night. This is why kids require so much more sleep, because their bodies are growing and developing at a much faster rate than an adult is, babies especially. So this vagus nerve is highly, highly important, and science has started to figure out when that has low tone, when that has low electrical impulses, what do? Well, they cut. They cut inside and they hook some electrodes up to that vagus nerve, and I'm pointing back here because this is exactly where it exits on both sides. And what they do is put a little, looks like a little patch, like almost a pacemaker. And there's a magnet, you can wear it, an adult can wear it on their wrist if it's needed for a child to help stimulate it, turn it on, and to be able to turn it off or turn it up as well, and start stimulating that vagus nerve in order for the body to start operating the way that it's supposed to put on what we call the brakes, to heal, to repair, and to restore. The great news is chiropractors can do that very specifically and gently without the use of surgery or medication, which is fantastic. So when people are coming in here, they're like, man, now I have so much more energy. What I'm eating really seems to matter, or I'm actually having the right amount of fecal matter coming out of my body, which I had no idea was stored up there so long, or in infants and babies. It's great. This is a great response. Sleeping is a great response to the vagus nerve operating appropriately. So if you guys are wondering what that gut-brain connection is and why maybe you are eating foods that are fantastic for you and they should be healing you and you're just not quite there yet, you need to get your nervous system assessed. You need to get that vagal tone assessed. You need to figure out if this is what's limiting your brain from getting all of the nutrients that it needs, because you deserve a better life than that. I'll talk to you guys soon.